just going to be taking this bandage off and then examining the wound and applying new bandage while maintaining a sterile field. So I'm going to clean my hands and apply gloves. And then I'm going to take this bandage off, look at the gauze and look at the wound. Fold this up, take the gloves off and throw that out. So now I'm just going to look at the wound, look at how big it is, look if there's any signs of it getting bigger, if there's any redness, swelling, edema, look at the XG date to see if there's any blood coming out, if it's green, if there's pus, things like that. So then I'm just going to clean my hands again and apply new gloves. Then I'm going to go ahead and open up my sterile field. First I'm going to look at the packaging and I'm going to look at the expiration date and make sure it's still good. Yes, it is. So then I'm going to open it up. While maintaining a sterile field. While you're trying to maintain a sterile field, make sure that there's a 1-inch border around this that you cannot touch. Don't let any liquid or anything get on top. And if you think that you somehow broke your sterile field, just start over. So I'm good. Now I'm just going to go ahead and I'm going to be pouring my saline into my tray. Before I do that, actually, I'm going to take my forceps out. Oh, shoot. Oh my. There we go. Take them out and rest them on the side. While trying not to touch. Oh my goodness. Anything else. Oh my goodness. And again, that would be breaking your sterile field, so you would just start over. So now my forceps are out. I'm going to be looking at my normal saline. Check the expiration date. Okay, it's good, and after saline has been opened, it's only good for 24 hours after. So I'm going to open it, hold my hand over the label to make sure that if saline runs down the side, it doesn't ruin the label for anyone else. Keep my T-Rex arms and just lift the bottle. Now I'm going to go ahead and just pour a little bit into my saline tray while trying not to spill any on anything. Okay, that's good. Now I'm just going to take my forceps. I'll try not to touch anything else. I'm going to pick up some gauze, get it wet, and then just wring it out. And then I'm going to clean from clean to dirty in an outward motion. So start at the middle and work your way to the outside. One swoop, throw it out. Grab another one. Get it wet. And again, wring it out. And then again, clean to dirty. Okay, so now my wound is clean. I have to dry it off. Get another gauze that is dry. Do not get this one wet. And then we're going to dab. We're going to dab on all different parts of the gauze. Okay, now my wound is nice and dry, and I am going to grab another gauze, a big one, and place it over top. Put my forceps off to the side and grab my tape that I've already previously ripped off. Make sure that you try and rotate the gauze every time so you don't cause too much skin irritation. The tape on. Also check allergies, because sometimes different patients are allergic to different types of tape. and assess pain level to make sure that they're not in any pain, patient safety, and then clean up, throw this out after, wash your hands as you're leaving the room again, and then go and document your findings in the progress notes.